of the president. The statement explains that upon the directive of doctors, all staff working for and around the president are routinely and rigorously checked for the virus under the supervision of the Chief of Staff, Professor Ibrahim Gambari. The Senior Special Assistant to the President on Social Affairs and Domestic Matters, Saruki Abba, always tested negative for COVID-19. And President Muhammadu Buhari has expressed the concern of his administration about the sudden spiral of food prices at a time when the economy is already mired in a slowdown occasioned by the global coronavirus situation. The Senior Special Assistant to the President on Media and Publicity in a statement states that the President assures Nigerians that the situation is transient. His administration has already begun looking and putting in place measures to ameliorate the situation, while Providence has been kind to Nigeria with the rains and as such an expectation that a bumper harvest would lead to crashing of food prices and ease the burdens on the population. Government's concerns about the exploitative market behavior by actors. Nigerians have already suffered grave economic losses owing to the coronavirus pandemic, and the Buhari administration will do all in its power to ensure that the people do not continue to suffer additionally from high food prices. In the meantime, President Muhammadu Buhari has expressed deep concern over the heavy flooding in Kebbi State that left in its wake destruction of lives, farmlands, farm produce, houses and other personal belongings in the affected communities. The president described the incident as a setback to the nation's efforts at boosting local rice production as part of measures to stop food importation. He noted that Kebbi State is the focal point of the federal government policy to produce rice locally as part of his administration's commitment to agricultural revival, which suffered relative neglect in the past. President Buhari noted that the bad news couldn't have come at a worse time for Nigerian farmers and other Nigerians who looked forward to a bumper harvest this year in order to reduce the current astronomical rise in the cost of food items in the markets, while sympathizing with the bereaved families and farmers affected by the devastating floods. The president promised to work closely with the Kebbi State government in order to bring relief to the victims. In the meantime, there are high hopes that the damaged Rigachikun Bridge along Kaduna-Zaria Highway will soon be opened to traffic. This follows the commencement of Wednesday work on the bridge. Abdullahi Mohammed reports.
The bridge's transition bay is what gave way a couple of days ago. This is now left for the archives. An environmentally friendly method is being deployed to build a new transition base, which experts say will give the bridge a formidable stand.
What was there before was lateritic material. Now we cannot repeat that again because of the weather. If you have to put laterite, you must work within the optimum moisture content to be able to compact the material very well. That we cannot do. That's why we're using boulders. After boulder, we're going to put other aggregates, then laterite, then we'll now fill up the place.
Going under the bridge reveals some things to be concerned about. There are cracks on the bridge, and also the boulders used in refills are also giving way.
That may turn out worrisome, but road engineers dispel it as a usual occurrence.
Yeah, that sounds like they are just superficial cracks. So they are just there. You are bound to see the superficial cracks in any structures.
The traffic was light, but the Federal Road Safety Corps says controlling it in the last 3 days was a handful task.
We make sure that we have our personnel on the road to make sure that extra lanes are not formed.
Whenever there is a problem like this, there used to be a very heavy traffic jam that one will stay in the traffic jam for up to 4 hours before going home.
The Rigachikun Bridge is said to have been built more than 50 years ago. In Kaduna, Abdullahi Muhammad, NTA News.
And the Kano State government says it is working hard towards ensuring that the state is free of armed robbery, banditry and kidnapping and other forms of criminality. This is contained in the report on security challenge in Kano State presented to Vice President Yemi Osinbajo by Governor of the state, Abdullahi Ganduje, during a courtesy visit to the presidential villa in Abuja.
I submitted a report to him that it is all well in Kano. We are managing. There is high coordination of the security agencies in Kano. They are working very hard. The only problem we have the Falgore forest, which we are providing some infrastructure for military training in order to avoid the bandits to colonize that particular environment, and we are working very hard on that.
State House correspondent G.D. Onifade reports that the governor also made comments on his administration's efforts to boosting the economy and improving education, stressing that the government and the people are making huge contributions in achieving these goals. Now, schools across Europe reopen as COVID-19 cases increase, just as India reports about 80,000 coronavirus cases in one day. Joyce Ametu has a global update on the pandemic.
Despite a continuous decline in daily coronavirus infections in Nigeria, there has been a slight uptick in the number of deaths. The country's Center for Disease Control said Nigeria recorded 10 new deaths from COVID-19 in one day, bringing the number of fatalities in the country to 1,023. So far, 54,247 cases have been confirmed, out of which 42,010 patients have recovered. Africa has 1,265,750 cases, resulting in 30,127 deaths. Figures compiled by Worldometer as at 6 p.m. Nigeria time show that the world has registered 26,007,449 cases, while more than 18 million have recovered. 863,101 deaths have been recorded. In a recent development, the rate of COVID-19 cases and deaths have stabilized across Colombia, prompting the government on Tuesday to lift more of the emergency measures that had been in place for 5 months. In Thailand, that country's prime minister congratulated the nation, having achieved 100 days without a confirmed locally transmitted case of coronavirus. Meanwhile, India has reported 78,357 new coronavirus cases in one day, taking its total to more than 3.7 million infections as the government eases COVID-19 restrictions nationwide. In the meantime, the United States has indicated that it will not participate in international coalition efforts led by the World Health Organization to find and distribute a vaccine for COVID-19. And reports from Europe say schools have cautiously reopened amid the rise in new coronavirus cases on the continent. The president of Madrid, the Spanish area hardest hit by the coronavirus, however, said necessary steps are being taken to make schools very safe for the children. And that's a global update on COVID-19. I am Joyce Ometu.
In the meantime, the Nigeria Center for Disease Control and CDC has continued to advocate need for states to take ownership and sustain the activities of their Emergency Operations Centers (EOC) by creating an independent budget for their operations. This came to the fore again at a capacity strengthening seminar for Akwa Ibom State frontline responders drawn from various ministries, departments and agencies. Ifeoma Ayekoje has details.
Lessons learned from Ebola and other outbreaks, the NCDC, under the leadership of Dr. Chikwenye Kwazu, had initiated the establishment of public health emergency centers across Nigeria. To further strengthen the effectiveness and efficiency of such emergency operations center in Akwa Ibom State, the NCDC has begun a capacity strengthening program on fundamentals of emergency response management to coordinate the actions of key stakeholders in support of the incident management activities.
By so doing, our knowledge and capacity has been improved, so we are going to be able to work better.
The synergy that will be achieved will go a long way to mitigate the problem of COVID-19 in Akwa Ibom State.
The training, according to the head of Emergency Operations Division, NCDC, Dr. Evaristos Enyako, is to develop participants' capabilities to put up incident management system structure with a clear knowledge of their key roles and how to develop sustainable emergency operation plans even before any outbreak. The target, he says, is to build a frontline team that can swiftly respond to any epidemic within 120 minutes.
So we develop different SOPs, even business continuity plans, to ensure that the EOC runs after establishment.
The 10-day-long program has the support of Akwa Ibom State Government. In Uyo, Ifoma Ihoji, NTA News.
You're watching the news on NTA International. More stories in a moment, to stay tuned.
From dusk to dawn, 24 hours a day, NTA International is with you in your living room, office, everywhere and anywhere. We provide the company you desire in terms of balanced and up-to-date news, programs and the best of entertainment. Tune in to DSTV channel 251, GoTV channel 91, Freeview UK channel 264, or you can download www.visiontv.co.uk. App for iOS or Android, Intelsat 901 degree east. You can also see us on Facebook and YouTube for quality content on the go. NTA International, Africa's window to the world.
You're welcome back. The World Health Organization warns that the coronavirus pandemic threatens to reverse global progress in the immunization of children under 5 years if certain measures are not taken. Uche Ugochukwu in this report examines how this is playing out in Abuja, the Federal Capital Territory.
The WHO estimates 2 to 3 million deaths are prevented annually through immunization. But Nigeria is set to account for 30% of global unimmunized children aged 0 to 5 years, despite concerted efforts by stakeholders to reverse the trend. The coronavirus pandemic has made the situation more precarious globally, and the Health Organization fears a decline in successes achieved in the past years. In Abuja, however, vaccination centers are busy. Mothers like Rosemary and Joy understand vaccines are key to protecting their children against the 5 childhood killer diseases.
Whenever my appointment reaches, I come for it. I don't miss anyone.
If I miss the immunization schedule, it will affect my child in one way or the other. Initially, when the lockdown started, there was a decline. But right now, the number has actually increased.
Nigeria hopes to keep making progress in its efforts at universal immunization coverage despite COVID-19.
So as at the last time we checked our data, we've now started seeing that primary healthcare services, especially routine immunization, is going back to the levels they used to be before the COVID-19.
Babies Alaric and Mitchell are expected to be fully immunized by the time they are 12 to 23 months, as captured in the country's immunization schedule. Uche Ugochukwu, NTA News.
Now, the two main candidates in the Edo governorship election are sheathing their swords and asking their supporters to do same to ensure a peaceful election on the 19th of September. This is the affirmation they made before the Oba of Benin, who is bringing them together to forge peace. Ugochukwu Ona has details.
The two candidates, Godwin Obaseki and Pastor Sage Izeyamu, practically demonstrate the peace pact with an embrace. Before this event, the political environment in Edo State has been unfriendly, creating apparent tension. But from what we are seeing, those unfriendly acts seem to be history.
We want to thank you for the powerful role you have continued to play. Pray that God Almighty let us pursue this road will give you very many more years. I want to assure our father, and all those present that we as a part pledge to ensure from our supporters, our followers, that they conduct themselves peacefully. We must ensure that there's no violence in this election. It's a family one.
Other stakeholders are also getting on the same page.
I share your concerns, and I assure you, to the extent that I can speak, we will speak to the Edo people and to our supporters and even non-supporters to abide by emergency instruction.
I believe it is in the interest of all of us and the good people of this state to maintain peace before, during, and after the elections.
Completely relieved at what Your Majesty has had to say and the kind of responses that we are getting from the principal actors.
This pact of peace is at the instance of the Benin Monarch, who is passionate about seeing a peaceful governorship election in Edo State.
Please, I want to beg you, I want to plead, what I want to hear from both parties. From today, you have visited us, you want to assure me, one way or the other, we work together with Pastor Israel, together, not different. Because you are here.
The Oba believes with this, peace has come to the political space in the state. In Benin, Ogochkuka Ona, NTA News.
Now, we earlier had a report on sustaining immunization in Nigeria. Now joining us live via Skype to speak more on efforts to sustaining the immunization of children under 5 years is Dr. Anis Sadiq, head of immunization, UNICEF. Well, thank you so much, Doctor, for joining us on NTA International News.
And thank you very much for being with me.
Now, against the backdrop of UNICEF's warning about a possible decline in immunization due to COVID-19, which you said if certain measures are not taken. Now, what measures are you saying should be put in place?
You are right that UNICEF and WHO has immunization coverage. This is not only in Nigeria. The worldwide, the health services and immunization services has been disrupted. But in Nigeria, we are taking a couple of initiatives. For example, the immunization are given to the primary healthcare centers where children and caregivers are coming, and also the outreach sites where vaccination team are going and giving that services. So the government is trained all the vaccinators so that they can deliver vaccine in the primary healthcare centers as well as the outreach sites. Apart from that, we know that number of children missed due to the COVID-19. A special initiative is taken by the National Primary Healthcare Development Agency. It's called Integrated Medical Outreach Program. That is a special effort to reach out to the community to deliver vaccine. So there are several approaches are underway to reach out and to reduce the gap.
Okay, now, Doctor, in the agency's capacity, talking about UNICEF, what is the agency doing to prevent reversing the progress made so far in immunization?
Now, we have been working shoulder to shoulder with the government and other partners. And as you ask about UNICEF role, our role is very, very specified, and we are trying to ensure the vaccine supply. Even in the COVID period, we are able to bring all the vaccine inside the country so that supply chain is not interrupted. We have chartered flights, and those flights brought all the vaccine, and there is no shortage of vaccine. And these vaccines are going down to the state as well as the local government agencies as well as the primary healthcare centers. Other than that, we are also involved engaging our community networks, platforms. We have 20,000 people on the ground working day and night to ensure that the under 5 children and under 1 children are vaccinated, and involved in creating demand, their line listing, and making sure and promoting them to go to the vaccination site.
Okay.
Also, we are also monitoring the progress as well as where it is deteriorating, so that we can advise government accordingly.
Okay, good move there. Now, before I let you go, what would be your advice to Nigeria in sustaining the efforts at routine immunization?
It is obviously a two-pronged approach. One is that the service provider, like government officials, the primary healthcare officials, vaccinator, we need to ensure that the vaccination are taking place and ensuring all the sites are functioning. And the other part is that on the caregivers, on the parent side, that we should know, even in the COVID period, that we need to ensure the children are vaccinated. That is the only way we can go ahead and maintain an optimum coverage for routine immunization.
Okay, Dr. Anis Sadiq, thank you so much for sharing your time with us on NTA International.
Thank you very much.
Well, that was the head of immunization, UNICEF, talking on efforts at sustaining the immunization of children in Nigeria. Now, moving on, the Speaker of Nigeria's House of Representatives, Femi Gbajabiamila, says he is hopeful that Nigeria and Ghana will arrive at mutually acceptable resolutions on the trade disputes that erupted some weeks ago. The Speaker, who led the delegation of lawmakers from the House of Representatives, said this when they were received by the Speaker of the Ghanaian Parliament as they arrived Accra, the capital of Ghana, on a legislative diplomatic mission. Gbajabiamila said the two-day visit to Ghana was meant to explore legislative diplomacy towards resolving the issues affecting both countries. Welcoming the Nigerian delegation, the Speaker of the Ghanaian Parliament, Professor Kwae, who expressed confidence for an amicable resolution, hoped that the next 2 days will bring a beautiful reunion to the two nations. The delegation, while at the Nigerian High Commission in Ghana, were informed by the leader of the Nigerian Union of Traders in Ghana, Chief Chukwuemeka Levi Naji, that Nigerian traders have their trades registered with appropriate agencies, pay their taxes and when due, yet have since 2007 been allegedly subjected to harsh treatment by the authorities. He appealed to the Speaker to follow up on the legislative diplomatic initiative in order to ensure that the resolutions arrived at implemented by the Ghanaian authorities. Now, talking sports, the rehabilitation work begins on the main bowl pitch of the Moshood Abiola National Stadium as Anthony Joshua labels fight with Kubrat Polev, a banana skin. Details with Bade Adelie on Sports Update.